Hello, my name is Dr. Dewan S. Raja. Today I will discuss about central pontine myelinolysis. Central pontine myelinolysis is a neurological disorder characterized by the destruction of myelin in the central portion of the brain stem, particularly in the area of the pons. Brain stem has three parts. The upper part is the midbrain, the middle part is the pons, lower part is the medulla oblongata. So what happens? There is destruction of myelin. Myelin is a fatty substance that forms a protective covering around axons, allowing for efficient transmission of nerve impulses. So it is very essential for nerve impulse by saltatory movement, as well as it insulates the nerve fiber, the axon. When myelin is damaged or destroyed, as in the case of CPM, that is central pontine myelinolysis, it disrupts the normal functioning of the nerve cells. What is the pathogenesis? Why this happens? Central pontine myelinolysis is an acute disorder characterized by loss of myelin in the base of the pons and portion of the pontine tegmentum. Typically in a roughly symmetric pattern, it most commonly arises 2 to 6 days after repeat correction of hyponatremia, leading to osmotic changes in the brain cell and subsequent damage to the myelin sheath, and is clinically known as osmotic demyelination syndrome. Other potential causes include liver disease, malnutrition, alcoholism, certain medical treatment. Pathogenesis continued. It appears that rapid increase in the osmolality damages the oligodendrocyte through an uncertain mechanism. What is oligodendrocyte? Oligodendrocyte are a type of neuroglia which is very essential to form myelin around the axons of the central nervous system. Inflammation is absent from the lesions and neurons and axons are well preserved. Because of synchronous onset of damage, all lesions appear to be at same stage of myelin loss and reaction. Originally described in the pons, extrapontine lesions with similar appearance and apparent etiology may also occur. So it is not always in the pons. Other part of the brain or central nervous system may be affected. It can involve most part of the brain. Periventricular and subpial regions are spared, and is extremely rare for the process to extend below the pontomedullary junction. So it usually does not happen in the medulla oblongata or in the spinal cord. It happens mostly in the pons, maybe in the midbrain, maybe in the cerebrum. Okay. Symptoms of central pontine myelinolysis. Symptoms of central pontine myelinolysis can vary depending on the severity and location of the damage that may include. The clinical presentation is rapidly evolving quadriplegia, that means all four limbs are paralyzed, which may be fatal or lead to severe long-term deficit, including locked-in syndrome, in which patients are fully conscious yet unresponsive. Okay, we have found that symptoms are variable depending on the severity and location of damage, weakness or paralysis, particularly affecting the muscles of the face, arms and legs, difficulty speaking or swallowing, impaired coordination and balance. Okay, because the cerebellar function may not go properly, is not coordinated with that of the cerebrum because of the Pontine myelinolysis. Changes in the consciousness ranging from confusion to coma, vision problems such as double vision or difficulty with eye movement. This happens due to the involvement of the pons of the brain stem. Diagnosis and treatment. Diagnosis of central pontine myelinolysis typically involves a combination of clinical assessment, imaging studies such as MRI scans, and laboratory tests to evaluate electrolyte levels, because we know that hyponatremia, repeat correction of hyponatremia, is the most common cause of central pontine myelinolysis. So electrolyte evaluation is very important. MRI should be done to find out is there any demyelinating changes in the brain or particularly the pons. Okay. Treatment of central pontine myelinolysis focuses on supportive care and addressing the underlying cause. In cases where hyponatremia is the cause, it is crucial to correct sodium level gradually, never rapidly, and cautiously to prevent further damage. Rehabilitation therapy may also be beneficial to help patients regain lost function and improve quality of life. Okay, so there may be possibility of regain lost function and improve quality of life by rehabilitation therapy. Okay, this is the MRI of central pontine myelinolysis. This is the pons and here is the myelinolysis here, and it is bilateral. And here is the pons affected. Pons is affected here. So prognosis of central pontine myelinolysis. What is the prognosis? Prognosis for the individual with central pontine myelinolysis can vary widely depending on the extent of damage and the underlying cause. Some individuals may experience significant improvement in symptoms with appropriate treatment and rehabilitation, while others may have persistent neurological deficits. Early detection and management of risk factors are essential for preventing central pontine myelinolysis and minimizing its impact on neurological function. And that's all about the central pontine myelinolysis. It happens mostly in the pons. Pons is a part of midbrain, and myelin is lost, okay, because the oligodendrocyte which forms the myelin, that is affected in this disease process by some unknown mechanism. So best way to prevent is that to correct the hyponatremia gradually, and diagnosis is made by MRI as well as the electrolyte assessment. Okay, so thank you very much. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.